I'm Zoe and this is Sam. We're here from the Children's Referral Management Centre. We're based at Isbrook Hospital and we're here to showcase our latest development, which is the launch of a new online referral system. Before I launch into the detail of that, if I could just give you a bit of background about the RMC and what we do, because I don't recognise many faces here. The RMC was set up 3 years ago with the primary vision of making access to and making referrals to children's specialist services easier, more consistent and more robust for referring agents working on behalf of the children and families that they were working with. The vision was also to improve the outcomes of those referrals, because we knew that they weren't terribly successful and they were taking far too long and families weren't accessing services quickly enough, and when they did sometimes it wasn't the right service. So what the RMC have done is effectively streamline and standardise the clinical screening process and the administration that sits behind it. This has improved the patient experience massively, but it has also offered the trust, cost saving in overall admin cost. We centralise the admin and we are quite a small team, as you can see. So I'm going to hand over to Sam and she's going to talk about how we did the latest development, the online system, and then I'll come back and speak to you after that.
Okay, I'll just describe how we engaged the team and brought them through this change, this new development for the online form. So we adopted the healthy team module, and using project management and change management techniques, we put in place a project lead within the team. Their aim was to facilitate effective communication within the team and also with the project management office, communications and stakeholders that we're going to be using the form. At the start of that, we put together a project plan. So we put down all the tasks, responsibilities, timings that we had, and we started that from looking at what the final outcome we wanted to be, what our final aim was. And then we worked backwards from that, what we needed to do in order to reach that point by the date of our launch, which is the beginning of June. So that involved the team at all stages. So they were involved from the beginning, communicated with team meetings of development progress, how we were getting on with designing the form, and it was a two-way communication, so they gave us input and feedback on how far we were getting, some ideas that we perhaps hadn't thought of, and then when they involved and we got the final design, they were involved in testing it, making sure it all worked for them when we received the referrals in. So they provided some very constructive feedback, which we were able to listen to, and then that influenced the final design that we see here today. So that gave them a sense of involvement and empowerment, and that they'd got ownership of this. It wasn't just the managers coming and saying, this is what we're going to do now. They're involved in it. But we also involved external stakeholders in the testing of it as well, because ultimately they will be the ones sending in the referrals. So we needed the end user feedback as well. So I think the success has been recognising the value that the RMC team, the very small team, has provided, and that's improved the RMC facility for healthcare professionals making the referrals, but also for the patient and their families. Their experience is much better.
Up until today, no external comms about this has gone out whatsoever. Despite that, almost 10% of our referrals in June came in using this system, which is delightful. They are the eyes and ears. They know what referrers like, what they don't like. They know what the challenges to the families are. And we're actually quite a unique team in that we can do that step up and step down between the referrers and the specialist services, so we can help other services develop as well through the information we gather. So we are delighted to be launching this. We very much expect our developments to continue. We do embrace every single one as a team, because the whole team feel involved and they share that knowledge every single day. And we just like to say we're really proud of how integrated, inclusive the team is, not only in the trust but externally and with essentially the families, and how pleased we are to actually be part of delivering much more individually based outcomes.